Once again, thank you, the Pinehurst Library, for having us here today, doing this Medicare educational approach, just a seminar on basic Medicare. We won't be going over any plan-specific items because that's not allowed in this type of setting. This is strictly educational, and Medicare is very strict about that. So we're going to be talking about the ABCs of Medicare. My name is John Bousquest. I'm independent insurance. I work with Medicare Resource Group. Medicare Resource Group is appointed with all the local carriers in the area, and we put on these educational seminars just to bring the basic information to folks, because people are entitled to know when they're ready for Medicare, what's all the plans and everything that's available to them, all the different ways to access your Medicare benefits. So what we're going to be going over today is, what is Medicare, who is eligible, how and when to enroll in Medicare, very important, the 4 parts of Medicare, A, B, C, and D, and programs for people with limited resources. And we're going to go over another program called New York Epic. It's a wonderful program that doesn't get advertised enough, and it could really be, it's a no-brainer. Everyone should apply for it. We'll go over it in more detail during the presentation. Now, what is Medicare? What is it, right? What is it? It's a federally sponsored individual health plan providing coverage for medically necessary. The key word here is medically necessary. Okay, nothing cosmetic. If you have an injury or an illness that's medically necessary, it will be covered. Now, Medicare itself comes with a price. Requires co-pays, co-insurance, deductibles that are responsibility of the beneficiary or of a secondary insurance. And that's what we're here for, to find out what that secondary insurance is all about. So who's eligible? 65 years old, older, and participate in Social Security, retirement, railroad retirement, employees of federal, state, local governments, or if your spouse has participated, you'd be eligible. Okay, someone stay at home, their spouse worked, participated, and they'd be eligible as well. Individuals under 65 that have been awarded Social Security or railroad retirement disability after 2 years, after 24 months, they would be eligible. Those disabled due to ALS or Lou Gehrig's disease, and individuals with end-stage renal disease. Now, all these groups weren't always included. For example, those eligible disabled due to ALS, that came in 2001 as a benefit to those folks. Individuals with end-stage renal disease was in 1972. So throughout the 5 decades of Medicare, different groups have been eligible for benefits. So the 4 parts of Medicare. First of all, can anybody tell me when Medicare first began? Anybody have any idea? It was 1965. Okay. July of 1965, the administration was the Johnson administration, and it was an amendment to the Social Security Act. Title 18 was for Medicare and Title 19 was for Medicaid. Because the original Social Security Act of 1935 did not have a medical component in it. Okay? So that was 1935. In 1945, President Truman started instigating and advocating for health care for seniors. He was saying, listen, our folks, when they retire, they're losing whatever little benefits they have, and no one is insuring them. We got to do something. But that was 1945. It took 20 years later, in 1965, for it to become law. And what President Johnson did when he signed that piece of legislation, he was in Missouri at the Truman Library in Independence, Missouri, and President Truman was there. He wanted to give him credit for being the one that instigated this and got this thing going. And President Truman got the first Medicare card, July 1st, 1966. Part A and Part B were effective for him that day. Okay, so, and he wanted to give credit for that. And the reason I bring it up is through all the 5 decades, any Medicare Modernization Act or anything that took place doesn't happen overnight. Okay, it's an act of Congress that takes to have any changes. So when you hear that Medicare is going to change and this is going to happen and this is going to happen, that's good. But I won't lose any sleep over it because nothing happens overnight. So we're going to be here for a while. All right, so now the 4 parts are Part A and Part B, which are considered called original Medicare. Okay, that's original Medicare, Part A and Part B. And that's what's represented with your red, white, and blue card. Part C and Part D are private ways to also enhance the benefits with A and Part B. Okay, so and A is your hospital insurance, B is your medical insurance, your doctors. C, if you can see, combines the H, the doctor, and the prescription drugs. And that's more like major medical. We're used to HMOs and PPOs and those types of plans. That's what the Medicare Part C Advantage plans are. And then the Part D is your prescription drug coverage. Okay, these Medicare Advantage plans came around in 1970s and 80s. What happened was the insurance companies went to the government and said, listen, you guys, let us handle and make it managed care. We will, manage it, and it's supposed to reduce costs and be more efficient. And then in 1997, they started calling them Medicare Advantage plans. But they took a while to develop. Again, nothing happens overnight. And then the Part Drug D plan, in 2003, they needed to do something with the cost of medication. And again, in 2006 is when Part D became effective. Okay, any questions so far?
Keep going.
Huh? Are we good? So what does original Medicare cover? Remember, original Medicare is Part A and B. So Part A is your inpatient hospital coverage. You have to be admitted, and you're in the hospital, okay? So now you get a little better, but you're still not well enough to go home. So you go to a skilled nursing facility to give you some rehab. It's not custodial, but it's rehab to get you back on your feet again, okay? And you required a minimum of 3 days prior in being in the hospital. That was eased up a little last year because of COVID, and they needed the hospital beds. So that there was a little lax there, okay? Home health care, again, it has to be someone skilled that's coming to your house for speech therapy, physical therapy, occupational therapy, something, again, rehabilitating, get you back. Hospice, that became a permanent benefit in 1984, and then blood where you're in the hospital. Now, Part B, the following services are generally covered at 80%, okay? Doctors' services, physicians, you got outpatient, you get a knee scope, there's something going on, that'll be covered under Part B. Home health care, you say, well, it's both places. Yeah, because there you need it, but you weren't hospitalized, but you still need some kind of home health care for one of those surgeries you may have had. Durable medical equipment means durable, something that you could use more than once. A wheelchair, a cane, a walker, some kind of pump or something that you could use more than once. Durable medical equipment. And then blood when you're not out of the hospital. Now, the Medicare benefits are administered by the Centers for Medicare and Medicaid Services. There's always been some agency administering those benefits. But the latest group is called CMS. And they are in charge. Nothing goes through healthcare without going through CMS. Medicaid, Medicare, Child Health Plus, the exchanges, anything with HIPAA, Medicare, the CMS is people we need to know. The reason you want to know that number is if you ever have a question about a benefit or a grievance against a physician or a medical clinic that didn't treat you well, that's who you would call. That's the number, and they would follow up on that. Now, let's get this out of the way. What's not covered by Medicare? Outpatient prescription medication, that's why you need a Part D. Okay? Routine dental care, routine vision care and eyeglasses, hearing aids, foreign travel. Medicare itself will not cover you in foreign travel. Cosmetic procedures and treatments. You need a little Botox or something, that's cosmetic. That's not necessarily medically necessary. And then custodial long-term care. They do rehabilitation, but not long-term care. Now, as far as routine dental and vision, if that's cleanings and stuff, they're not going to cover it. But if you had all of a sudden had oral cancer, now it's medically necessary, then it would be covered. Something that may not be, that starts out routine, depending if it becomes medically necessary, it's going to get covered. Same thing, vision. You start diabetes or something, that's going to hurt you. So your doctor may say, I want to see this patient every 2 months, medically necessary. You see? So that's the key. And something that starts out not being, could be. What does original Medicare cost? Well, we talked about Part A. Most people qualify just on their work history. Okay? When you've worked based on 40 quarters, equivalent to 10 years of contribution to the Medicare system paid through the FICA Federal Insurance Contribution Act by themselves or their spouse. Now, people with fewer than 40 quarters will pay for their Part A, and it could be as high as $471 a month. So that could be pricey. Now, people say to me, well, why do they say it's redundant? 40 quarters or 10 years, isn't it the same? It equals the same, but it may be 40 quarters that spans more than 10 years. You work for 5, you didn't work for 2, you work for 3, you didn't work, but all of a sudden you got a cumulative of 40 quarters, okay? Because people say it's the same thing, why do they say it twice? It's a little tricky there, but that's what it is. Now, Part B, people pay the standard monthly premium for, we haven't updated yet, these numbers are coming out, this was for 2021, $148.50. However, and on one of these handouts, you'll see the scale that will show you that if you are single and your income is more than $88,000 or married and income more than $176,000, you're going to pay more for your monthly premium, okay? They have an acronym, IRMA, Income Related Monthly Adjustment Amount. Medicare is great with acronyms, okay? And that what will happen is it depends on how much you make that will determine that. The thing about that to understand, and a lot of people don't know this, the Social Security goes back 2 years to look at those tax returns. So this year they were looking at 2019 to come up with that because those returns have been filed and they know that there'll be information on that. So if you can prove that because you've lost your employment or divorce or some other reason, you can have this appealed. You can, there's a form that you will put in there and say, listen, my income is not going to be that anymore, and then they'll adjust it back down. But they don't know that. Now, it could work the other way too. Let's say you retired and you were paying the $148.50, everything is going well, and then all of a sudden you're sitting down with your accountant and your financial advisor and they decide they're going to, let's sell this stock portfolio, or let's sell this piece of property. And so it's time to do it, right? You sell it, and at the end of the year you get a bill and the letter telling you that this is going to go back up again because it's based on your income and it went up. Now, a year later, it'll go back down again, but this could fluctuate. Okay, so the idea is to have the right planning so that you don't run into these situations. And the Part B premium is typically automatically deducted from a person's Social Security check. If you're not collecting, they'll bill you quarterly. Everybody with me so far? Okay, now, enrollment. There's a thing called automatic enrollment. And so if you're collecting Social Security prior to age 65, they already know who you are down at the Social Security, right? And if people under 65 entitled to the disability benefits, they're going to receive the card in the mail. And they don't have to do anything because, again, they already know who you are down there and they're going to send you that card. Now, you'll receive the card in the mail indicating automatic enrollment in Part A and Part B. The beneficiary has the option to decline the Part B coverage. And there's a time when that's a good idea, and we'll go further in the presentation. You'll know when you may want to do that, okay? And by returning the card to Social Security, it comes with a letter and instruction. You just cross out the Part B and you mail it back. That's how they know that you're declining that. And the coverage will begin the first day of your birth month, unless your birthday is on the first of the month. Then they go back another month and start you that month. We don't know why that happens, but it's a good deal. When it's not automatic, it's your responsibility to enroll, okay? Ways of enrollment is complete at www.socialsecurityadministration.gov. Real nice site, it's easy to do, okay? You follow the instructions, you open up an account. even if you're under 65, it's good to open up that account because you can see your history, your work history, what you've paid into Medicare. This information is good to know so that you can plan for retirement. You know, you may want to, oh, let me do something about it, or, you know, you have some information that empowers you as you go forward into retirement, right? You can call the local 800, that number, the 800 number. That's okay, you could do it online that way. The easiest way, again, is the online. Or you can make an appointment at the local office. The problem with that, they were backed up about 3 or 4 months because of COVID, you know, closed down for a while and limited folks coming in. So if you're going to do it that way, you want to call with plenty of time so that you can get an appointment in on time, okay? So that's when to enroll when it's not. We already know automatic, it's going to happen. If it's not automatic, you have to do it. So when do you start the process? All right, well, if you're turning 65 and you're not collecting Social Security retirement, you have a 7-month period to enroll in Medicare without a penalty. I don't know if you guys remember a program on TV called Beat the Clock. Anybody remember that? Where they set the time on the clock and they gave you a task to perform. And if you did it, you won. And if you didn't, you had to sit down. Well, that's what this is, Beat the Clock. And let me tell you how it works. So my birthday is October. So in the month of October, I go back 3 months to July, right? So July, August, September, October, November, December, January. That's my 7 window of opportunity. But the sooner you do it, then you want your benefits to start in the first of the month. So if you do it as soon as you're eligible, you're going to get your benefits the month of your birthday. If you go to the second month, you may, but you're getting close a little bit, especially with all the backup. The third, you're really cutting it close. Now, they do the best they can, but they can't promise you anything. There's no guarantees. So you do it early, and there's no problem. If you go a month after, delay again. A month after, delay again. Okay? And that's that 7-month window of opportunity called the initial enrollment period. There's several periods. This is the first one. You only get one initial enrollment period, okay? And this is your Medicare card, right? This is the red, white, and blue card. It has 11 digits, letters, and numbers. At one time, they used to have your Social Security number. And, you know, for obvious reasons, they don't do that anymore. And this is made up of the 26 letters of the alphabet and the digits 0 through 9. But they left out 6 characters. S, L, O, B, I, and Z. The letter Z. They look too much like numbers. So they left those out. Make it easier to read. That was pretty good. Okay, and so you want to take care of this card. What we do when we meet with someone, and we'll give them one of these little holders, and you got one, so that you can put your card in there and keep it nice and clean and pristine, because it's made out of paper, believe it or not. It's like paper. It's, you know, so you want to protect that card. And you got to know where it is at all times, because I find that people always know where their credit card is, but never where their card for healthcare is. So if you come, we have people come to the office, especially now they'll be coming, they want to change their plan. They don't bring the card. And so they think they can call Social Security. They're not going to give you the number over the phone. They don't know who's calling, right? They're not going to do that. So you want to take care of that card. Please put it in a nice, safe place where you know where it's at and that you can always find it when you need it.
Can you laminate them? Because at one time they say not to laminate your vaccination.
They don't want you to laminate it, so we get the plastic over here.
Why don't they just make them plastic?
Man, I don't know. They saved a lot of money making it paper. I don't know.
I imagine them really getting ratty after a while.
Yeah, that's why you want to protect that and nice, pristine, keep it clean. All right. So remember, we talked about the initial enrollment period, right? And then when you had to do it in the automatic enrollment period and when it wasn't automatic. Now, there's a general enrollment period. So for those that do not enroll during the initial enrollment period, there's another opportunity each year. And it's January 1st ends March 31st. Okay, enrollment during this period will have coverage beginning July 1st. So let me go back 2 slides and tell you how ugly this could get. Let's say that my last month to enroll was in May. And I kept putting it off May, and May came and I forgot all about it. Okay, I just missed my initial enrollment period. Now May, June, July, August, September, October, November, December. January, I can't enroll until January, February, March, April, May, June, July. It doesn't come into effect in July. I just had more than 12 months, okay? So, failure to enroll in Medicare when it is or you're initially eligible may result in a 10% premium penalty for one's life for each 12-month period not enrolled. So congratulations, you waited. Now you can get it, but you're going to pay a penalty. That's 10. So this year you would have paid another $14.80 above, and every time it goes up, you're going to have 10% that's going to go on top of that. Okay, no reason for that. No reason for that. There's 7 months is almost 60% of a year. You gotta get it in there. Okay. Now this penalty would be waived if you delay Part B because you had primary coverage through an employer, and we're going to get to that in a minute. Okay. So in other words, if you didn't do it but you had this kind of special coverage, you're okay. You're not going to get that penalty. So again, there's a bunch of special enrollment periods that Medicare provides for folks. So if the beneficiary or their spouse were actively working, they may be able to delay enrollment into Part B. We'll find out why it says may be able to. The Medicare beneficiary or their spouse has to be actively working for an employer that's providing group health insurance. And if the beneficiary is older than 65 years old, the employer must have 20 or more employees. Okay? The beneficiary older than 65, the employer must have 20 or more employees. So let's say you work for a small company, you've been working there a bunch of years, they got 15 or 16 employees, they love you, you've done a great job, and they say, we're going to keep you on the plan. And someone may want to stay on the plan because, they have a spouse that's under 65, or they may have a dependent under 26 that they want to keep on the plan, right? So now, they stay on the plan that they don't get Part B. What happens? 3 years later, they need to use the benefit. They go to the doctor, they get home, there's a bill. They say, whoa, I got coverage. Well, you really don't, because that would have been, the reason you need to sign up is because Medicare becomes the primary and the employer insurance becomes the secondary. Are you with me? So if you didn't do it, the secondary is not going to pay if the primary doesn't pay. Okay? So that's important to know that. First thing, you're working with somebody you're working, employ how many, over 100 employees, over 20 employees. Most people are going to say yes, but occasionally somebody will say, well, it's a small little shop, auto mechanic or something, and there's only 14 people. Then they got to know that that's a situation they got to take care of. Now, if you're younger than 65, then the employer has to have more than 100 employees for that to be creditable coverage. Okay? Now, one of the times is like the loss of employer coverage. Let's say all of a sudden you decide you've been working, but now you're going to retire. So it's the loss of employer coverage. You need to sign up for Part B and Part D as soon as you can. And they're not the same. Part B, you're going to see, is a lot different than Part B. So if Part B, you have an 8-month special enrollment period without the penalty. Right? So let's say this is your last day of work and you lost coverage. You have 8 months to get your Part B. Okay? The sooner you enroll in Part B, the sooner your coverage will begin. Now, enrollment in Part B also triggers a 6-month Medigap enrollment period. And all that means is that when you go, you got that 6-month, no medical underwriting, no medical questions, you're guaranteed issue. So you want to do that in that 6-month period. Okay? Part D, you only have 63 days to enroll in Part D without a penalty. We're going to get into the penalty later. It's not the greatest thing or biggest thing, but it's something that could be avoided again. And to me, it's better in your pocket and then having to, spend it when you didn't need to do that. Your plan will begin the first of the month following the month you enroll. You enroll in October, November 1st, November, December 1st. Anybody with me so far, right? Cobra, Consolidated Omnibus Reconciliation Act. Another one of those acronyms. I'm glad they use acronyms. Cobra is good. So, Cobra, when that came out in 1985, I believe, where they said, you know what, when you leave your employer, you can keep your coverage. Okay? You can go on that plan and then you're responsible. You pay for it yourself. So people have said, wow, when I was on my employer, I never paid that much. Now I got Cobra, it's through the roof. Well, you're paying the whole thing, number one. plus a 2% administration and management fee. Okay, so that's Cobra. And that's the other thing is that Medicare does not consider Cobra as creditable coverage. So what do we say? If you don't get it within a certain period of time, you must sign up within 8 months or you're back to penalties. Now, when we sit down, we advise folks because sometimes they need to stay on it. Again, they have a spouse or a dependent under 26. So for those 8 months, we can work out something that they can get so that the person who is getting this Part B doesn't get stuck with it, doesn't have a problem with it. We could work something out with the others to get other kind of coverage and they can go on into their Medicare. Failure to do so will result in possible delays because remember, then you can't go into the next January. And if it's too long, you're going to have a penalty. All righty? So, options to supplement Medicare. So, this is a country of choices. So you can just keep original Medicare only. And I think something like 20% of folks in the country just have Medicare only, which is Part A and B. Okay? They just have Part A and B. You're going to find out in a couple of slides where that's never really a good idea. Okay? You have Medicare Advantage plans, which these Part C plans you can use to supplement. I guess we're talking about how we're going to supplement because we know that Medicare doesn't cover everything and we need some kind of help. So how we're going to do it, you get the Medigap plans. Those are the A to G plans, the leaded plans. Okay, we'll talk about supplemental plans, which are Medigap are the same type of plans, and then standalone drug plans, Part D. So let's talk about the hospital for a minute under original Medicare. We know it's Part A, right? Hospital. So you have a deductible, $1,484 for 2021 for each benefit period. Let's clarify, a benefit period is 60 days. Okay, 60 days. You go in January 1st. As soon as your head hits the pillow, you owe them $1,484. Okay? Now, you come out January 12th. You go back in. Doesn't have to be for the same condition. You won't pay that because you're in your 60-day window. You go back on the 61st day, bingo, you owe them $1,484 again. Okay? That is the deductible. Part B is not so bad because it's $203 and it's not at once. Every time you go to the doctor, maybe $40, it goes down from $203 and down until it's $203. And then at that time, when you've paid that deductible, then your plan kicks in. We know that any kind of insurance you have, you pay the deductible and then your plan kicks in. The same thing here. Now, Medicare pays for 80% for covered services and the beneficiary pays 20%. Now, in my opinion, 80% is pretty generous. If I went with you to a pizza place and we were going to buy a pie and it was $10 and I paid 80%, I pay $8 and you pay $2. And if I give you half the pie, you got a pretty good deal. But if I kept 80% of the pie, then I get 6.5 slices, just for you to know. So, but we don't know. In that case, we knew that the 100% was $10. But here you don't know what 20% of what. If you get some kind of infusion, this could be $5,000. Your percentage is $1,000. If it's $10,000, you're paying, right? It's percentage-wise. If it's $200,000, and it could be, and the government could always pay their 80%, but can you pay your 20? That could be astronomical, and there's no limit to how many Part A's you can go, because if you divide 365 days by the 60-day periods, there's 6 in every year. So you can go in there multiple times, and you have multiple of those, multiple 80% or 20% of 1,000. See, if you go to a doctor and it's 20% of a doctor's bill, that may only be $100 or something dollars. But if you go for something serious, a knee replacement, a hip replacement, you're talking a lot of money there. And that's your 20% if you don't have secondary coverage here. Are everybody with me so far? So now you get out of the hospital and you go into the skilled nursing facility. So days 1 through 60, you already paid the deductible, right? We talked about the Part A, you had already paid that deductible. Now, inpatient here, you days 61 through 90, while you're in the hospital, now go to $371 a day. Okay, that's your 20%, but that's what it's going to cost you. Days 91 through 150, if you're really unfortunate and you spend that kind of time in there, you're going to use up those 60 lifetime reserve days at $742 a day. Anything over day 150, you pay all costs. Now, I've done the math. This is over $50,000, which means that the bill would have been about $250,000 if you didn't have anything, right? But if you have, and you don't have any other coverage, it's still a lot of money, over $50,000. If you get nothing else out of this presentation, understand that if you need something, whether it's a Medicare Advantage plan at a zero premium or a Cadillac supplement plan, once you get one of those, and that's our job to sit with folks and let them know, this slide does not apply to you. This will go away. You'll have some payments, but nothing like this. We're good? Skilled nursing facility, right? You went into the hospital, you came out, they didn't want you home yet. You went to the skilled nursing, you had to be in the hospital for 3 consecutive days or longer. Remember, it's not long term. It's just going to be rehabilitation. You're admitted to the skilled nursing facility within a specific time frame, generally 30 days after you've been discharged. And facility care must be for hospital-treated condition, what you were in the hospital for, or a condition that arose while you were receiving care in the skilled nursing facility. Okay, something like that happens here. So, and the facility must be Medicare participating, and most of them are. But you want to make sure you don't go to one of these boutique ones that don't take Medicare, and bingo. So now paying for the skilled nursing care. Days 1 through 20, Medicare pays, you pay zero. Okay, you don't pay anything for that. Days 21 through 100, $184 per day. I did the math, it's about $14,000, okay? With no coverage, this is what you're going to be paying. And then all days after 100, it's all costs. At that point, it really becomes long-term care, right? That's what it would become. And, you know, people work very hard and you know, they want to keep your lifestyle together and anything like that. So the sooner you start planning, and people do plan for long-term care, you see an attorney, and you see actually an elder law attorney is the best person to see, because there's ways to legally and ethically protect things that you have. You got to, you know, you can work if everybody wants to do things correctly, and then there's ways to do things if you have the knowledge and the information that you need to have.
What about somebody that's in the hospital and then they're sent to skilled nursing care, but then they have to go back to the hospital and then back to nursing care? Because sometimes it happens, you get bounced back and forth.
Well, if it's...
So is that, you're still talking about that same 60-day period?
You got that, yeah. You got those benefit periods.
Okay.
Now, medical coverage, the Part B, doctor services, outpatient medical and surgical supplies, clinical lab tests, urinalysis, blood work, durable medical equipment we talked about, something that durable and lasts more than one, diabetic testing supplies and strips and meters and things like that, and preventive services, very important. Part B gives you a lot of coverage. Part B gives you the most coverage. So I'm not going to go into each one of these separately, but I can tell you what happens if people don't do this. Let's see if I have that here for you. I must have left it at the last place. So what I was looking for was the Medicare and You book that everybody gets. Right? The Medicare and You book. Nobody reads it. On page 30, you see they got a list of all of these things, and they got like a little heart next to each one of them. Right? And so if you read it, it'll tell you when you can go for these screenings. Is it every 24 months? If it's every 12 months? If there's a history? So those are going to change, and it's all spelled out for each one of these, okay? The thing about this, though, is Medicare, you only get one, the first one, preventive visit. When you got 12 months, you should do it within the first 12 months when you get Medicare. You should go and get this exam. That's with the blue coat on, the blue gown. They're going to really ask you a bunch of questions, because the purpose of that is to come up with a blueprint for your medical going forward. How are they going to, what tests are they going to, they feel that based on your history, they're going to be able to come up with a plan. You're going to send you for this test. We're going to send you for this other test. And within, certain periods of time. Now, every year you get a wellness visit, and they're going to go back and review what happened the first year. How you doing? Are you following the instructions? What's going on? But you're not going to get a full physical. So you got to be careful, because a lot of folks think, well, I want to get a physical. But you got to let the doctor know it's a wellness visit. Because if it's a physical, you're going to pay for the whole thing, $400 or $500, because you already had your physical. Okay, you got to understand that you're only going to get one. Medicare Advantage plans, what they do is they like you to get one every year, because they're a business and they keep you healthy. They save money. They don't want you running around back and forth, emergency rooms and back and forth. So they're going to give you that physical. Okay, but Medicare itself won't. And a lot of good screenings here. Again, you get that book, I tell everybody, and sometimes somebody will bring it in and the binder's still never been snapped. So one of the ways to supplement is with the Medigap Policies. Okay, that's the Medicare supplement plans, the letters A through N. Okay, so the first thing is you must have both A and B to get a Medigap policy. Got to have those two. You pay a monthly premium to the insurer, and you also pay your Part B monthly premium. That never goes away. That Part B, you got to pay that anyway, okay? But the plan and it varies. We'll talk about that in a second. And they help pay for health costs that original Medicare doesn't cover. The gaps. Remember we talked about, and they call it Medigap for a reason, that 20%, those are gaps. And different plans will cover different gaps. So, the A, and we sit down and we review someone's needs and see which works best for them. Now, Medicare will pay its share of the Medicare approved amounts covered by the health care costs, and then your Medicare plan pays its share. So these plans are not a health insurance, they just pay for it, right? And then if Medicare pays for it, the supplement plan will pay for it. There's no questions asked. They're going to pay for it, okay?
No matter who your insurer is?
Well, yeah, well, exactly. Because whatever plan you got your Medicare plan from, we're going to talk about that in a second. It pays for its share, and the Medicare policy is only for one person. There's no group Medicare plans like that. So they're standardized, right? Designed to fill the gaps in original Medicare Part A and B. The deductibles, the co-payments, right? The co-insurance. The plans are designated by letters, okay? And they all cover a basic group of benefits, but they're standardized, which means if I buy Plan A from this company, or I buy from this company or this company, they're all the same. They're all the same, okay? So now, all plans cover basic group. Coverage is the same from company to company, but premiums vary. So let me ask you, if you were going to buy a car, and there was 3 dealers that had the same car that you really want to get, the only thing being different was the VIN number. The only thing different, because they can't be the same. Who would you buy it from? You want the best price and a reputable outfit, right? You don't want a guy here good price, but he says, hey, you want this car? You don't want that. You see what I mean? So you have to shop, because you're going to get the same benefits. Why should you pay more for the same benefits from one plan for the other? And some people do, for whatever reason. Are we good on this so far? The Medicare Advantage is different. The Medicare Advantage is another way to get your Medicare coverage, and they're still part of the Medicare. They're run by private companies, and here's how they work. Medicare pays an amount for each member that's in that plan, okay? The Medicare Advantage plan sort of is the interface between you and the government now. Remember, they still have to cover Part A and Part B, and they give you additional benefits. Some of them give you dental and hearing and vision and a gym membership and an over-the-counter benefit. There's a lot of benefits that they could put in there, and but they still always have to cover the Part A and the Part B, okay? There can't be any less than that. And the thing about it is you may have to use a network of doctors or hospitals when you have one of these plans, depending on what type of plan you have, right? We're going to go into those plans. And you always check with your health provider to make sure. You should always ask a question. You got to be involved with your own health care. You got to know, are you going to cover this? Is it who's paying for the vaccine? You got to ask questions. If you do, you won't get any surprises, right? And that's the whole idea. You want to be in command here. Now, these plans, they vary from county to county. You may get a plan in one county that's not available in another county. That's up to the companies where they're going to provide the plans. The types of Medicare Advantage plans. Top three are the most important. The HMO, everybody's heard of that. It's the most restrictive of the plans. You got to have, it's a network, right? A gated network of doctors. You got to have a primary care doctor. You need a referral to go to a specialist, okay? Again, limited in that sense that it's the most restrictive. You got HMO point of service is a little less restrictive. When they did it was they said, we're going to have what they call open access. And what that means is that you can go to another provider without a referral as long as they're in the network. Okay? You have the point of service, they put a little pool of money on the side for you, and you can go to a doctor out of the network until you use that pool of money, and then you're on your own. Okay? Then you're on your own. Preferred provider is the most popular, and that is where you can actually go out of network. You don't need a referral, but you'll pay more for that coverage from that provider. And once again, you should always check if they're going to accept your plan or not. Special needs plans for folks who meet certain criteria, chronic diseases, diabetes, congestive heart failure. There's a couple of special needs plans, dual eligible folks that Medicaid and Medicare, they can get those type of plans if they're available in your area. Private fee-for-service, again, most of them don't have any networks, but you got to go ask them, and they don't have to take the plan. And if you go next week, don't assume that they're going to take the plan because they took it last week. Ask them again. Ask them again, right? You want to make sure. Medicare savings accounts. There's also some like a high deductible Medicare Advantage. And what they'll do is that, let's say they put $2,000 in an account for you, but it's a high deductible. Let's say the deductible is $4,000. You can use that $2,000 to pay for your medical if you use it up before the end of the year, you still haven't hit the deductible. So now you pay out of your pocket until you make the deductible, and then the plan will pay. The nice thing about that, if you're healthy and you don't spend that $2,000, it rolls over. Next year they give you $2,000, you got $4,000. You're still healthy, then you got $12,000. And then and as you get older, you probably need to use it more. So it's good to have that there. But those are the types of Medicare Advantage plans. When you can enroll in the Medicare Advantage, during the initial enrollment period, remember when we said, hey, I just got my Part A, I'm going to get Part B, I think I'm going to join a Medicare Advantage plan. Okay? Your annual election period, which is what we're talking about now, October 15th through December 7th, people have a chance to join a plan, switch a plan during this time. Evaluate the plan. Remember, these plans are on a one-year contract that's going to go to the end of the year. And if you were not happy, this is a good time to talk about it. You also everybody gets, and this is mandatory, it's called ANOC, is another acronym, the Annual Notice of Change. And what it does, it gives you the plan that you have for this year. Alongside of it, that same plan with whatever changes. Did the premium go up? Did the premium go down? Is the benefit being covered? Is the formulary the same? The formulary, right? Your list of medications. So you need to check. We sit down with folks to evaluate that because they get in the mail. They didn't know what it was. They thought it was something else from Medicare, and they've got a 4,000 enough paper to make a tree, and they don't want it anymore. Anyway, so okay, and then you may be able to join. If you get a special enrollment period, for example, if you leave one county to another county, that's a special election period. If you qualify for some extra help for financial, you need some help, that gives you an extra enrollment period where you can get out of one plan without it being those standardized annual enrollment periods and things. Are we with me so far? Everybody all right? Part D. This is probably a little bit of the most confusing, doesn't have to be. And the reason it is because these plans are not standardized. So they differ. They're very, very different. The plans negotiate with the pharmaceutical companies, and whatever they got going, they can, and they make up their own formularies, and so they could be different, and they are going to be different, and so we got to watch out and check those every year. So anyone covered by Medicare Part A and or Part B is able to join a Part D plan. That would be a standalone drug plan, okay? Plans are sold by private insurance companies, and you require a monthly premium. Got to pay them a premium, okay? Each plan covers a group of prescription medications known as the formulary, and typically have co-payments for prescriptions and possibly an annual deduction for the plan. So you see the plan, the premium, annual deduction, and then the cost sharing, whatever that might be. Co-pay, co-insurance, whatever that has, right? And the formularies may change annually. So this is why it's prudent to check that formulary. You like the plan, everything was good, but let me make sure that a plan didn't go from tier 1 to tier 3, because it could happen. You hope some from tier 3 went down to tier 1, but you want to know that before you sign up, or you stay with the plan, or you go on to another plan.
Could you please explain to me the definition, copay and co-insurance? They're two different things.
Yes, copay is a dollar amount. My copay is $20.
Okay.
My co-insurance is 20%.
Oh.
That's what it is.
Oh, that's so much easier. Thank you.
Right? So you have a deductible, that's a dollar amount.
Okay.
You got a copay, a $20 copay. You always say, well, what's the copay? $20.
Okay.
What's my co-insurance? 20%.
Okay.
All right, very good, thank you. They're sold by private, each plan covers, or they may change annually. We already went through that. Oops, how can I get back to that other one? Here you go. So this is the standard rules that all drug plans have to follow. They're not being asked, they're being told. Before I get started with explaining, I bring this to folks' attention because I think it makes it easier. In this first stage, the deductible stage, I pay. I'm the only one paying. I pay. What am I paying? If there's a deductible, I got to reach that deductible. I'm the only one paying. I pay for a drug. If it's tier 2 or tier 3 that it counts towards the deductible, I'm paying until I hit $445. If it don't have to be $445, it could be $245. It could be $0. But it can't be more this year than $445. Are we there so far, right? I got to meet the deductible in this stage. I'm the only one paying. In the second stage, the initial coverage level, I pay and the company pays, so now we pay. I'm paying a copay, like you were asking, right? I pay a copay, and the company pays the balance of the retail of that medicine. So let's say my medicine is like Eliquis, and it's $500, right? So in this stage, well, in the first stage, the first month I bought it, I hit the deductible because it's right, so I'm already here. But here I'm only paying $50. But being counted towards this number that was the number this year to satisfy this bucket is $41.30. So my $500 plus the company's $450 equals $500. So that's $500 coming off of this. Next month, another $500 coming off of this. And next month, another $500, right? Most people, folks, will stay in the initial coverage. That's what it is. Like 83% folks stay in that coverage. Now what happens is when we hit that number, now we go into the coverage gap. Now the coverage gap, now you're paying a 25% for the drug, okay? No, that's a co-insurance now. And now you're paying 25%, and again, the whole amount of the $500 is being covered in this stage as well, towards that number of $65.50. Okay, you with me so far? If we reach $65.50 here, then I go into the catastrophic stage. So you can see that most people stay here, but if you're unfortunate and you got an insulin that may be $400, and you usually have to have insulin fast acting and slow acting, I mean, that's the way these things work, you can go through this coverage, the initial stage real quick, and through that stage as well. If you do, you get into the catastrophic stage, and now you're going to pay 5% of the drug. or there's a number value like 9, 20, or 5%, whichever is lower or higher. Very few people, and the thing about this is that it resets every year. Every year starts all over. You can't say, I'm in the kind of trouble. It does. January 1st, we're back to deductible. Now, when we sit with the plan, it may be, hey, this year I got a 0 deductible. Or I may have 200 deductible, or I may have 550. Depends what they decide. And these numbers and these buckets could go up, could go down. Now, folks, 25% is a lot, but at one time it was 100%. And then it went to, I think, 70, and then 50, and now it's down to 25%. And so we're hoping that things get better, but that's where it's at. Any questions on the drug plan? A lot of folks, and I said, if you think about it, I pay, we pay, I pay a copay, we pay, I pay a co-insurance, and we pay, and I only pay a small amount. Okay? Again, if you're unfortunate, and some people are, 1 in 20 will get 3 or 4 medications. Humira costs $5,800. $5,800. This one medication get like $14,000. But we're going to show you a way that they can get some help with that as well, okay? So Part D has some rules. Before you take any medication, sometimes, the government wants you to use generics. Generics do a couple of things. They save money. They save you money as well. And, so let's say, and the one that comes to mind is Synthroid. The medical generic is levothyroxine. That one costs $7. The Synthroid costs $137. Okay, so they're saying we want you to try 1 or 2 medications before we're going to allow that high brand name to go. Now your doctors know, so they'll work with you. If you are getting reactions or you're getting whatever it is that's not making you feel well, that medication doesn't sit well with you, then they'll do an exception and they'll give you that medication. But you got to follow the rules. There's also pre-authorization, right? You just can't order a drug. They may have to call the company first and say, listen, we need this medication. Can we get it approved? They may or may not approve it. Okay, or they may add something to the formulary that's not there. So there's things that you can do, okay? And then quantity limits. This became about the opioids. You can't order 5,000 pills of anything, right? No, you'd be surprised. So, but if they say 60, but your doctor deems necessary that you need 120, you'll get it. But you got to go through the rules. That's all it comes down to. Again, follow the rules. You're going to be fine. Is everybody with me so far? Part D, late enrollment penalty, LEP. Now, again, the higher you wait, the longer, the more the penalty, right? So if you pass the 63 days, unless you had credible coverage or you got some extra help, you're going to be eligible for the penalty. And it's only 1% of the base beneficiary premium nationwide. So this year was like $33, so it's only 33 cents. But that's for 1 month. Next month, 33. And it's for the number of months. So if you were out there 200 months, somebody who had 5 or 6 years and they never got a Part D, they're going to have a stiff penalty, right? So you want to go ahead and get it. You can get a 0 premium or a low premium if you don't take a lot of drugs. People say to me, listen, I don't take a lot of drugs. What do I need? And again, it's the choices. You don't have to have one. But let's say it's January. You didn't get it. You didn't go into the open enrollment. You didn't start. In March, you start getting this pain that people my age, 65 and over, always start getting once in a while in the back. And then it gets a little more critical. You go to the doctor and they find something bad, right? Now he's going to give you this medication. Let's say it's $8,000. Because I don't know what we found. Those stages, you got to meet those, right? That 25%. You're going to pay a lot of money for those medications because you didn't have a drug plan. And you just can't join a drug plan. When can you join? During the open enrollment period, or that'll start the next year, okay? Or unless you had a special election period. So that's what happens. And the amount changes every year. So that 1%, if it's then 2%, 20, 30, whatever percent it is, it's going to add up to your premium that as it goes up every year, you'll go up relative to that. Some folks get extra help, financial assistance available for people with limited resources. You go to the Social Security Administration and you just tell them, listen, there's this extra help, but you just find out. You don't know, if you don't, the answer to the question that was never asked is always no, right? So you got to go, it's income based, but you never know. You got to go and check. Okay, It can reduce or eliminate monthly premiums if you're eligible, reduce prescription co-payments, and provide continuous special enrollment periods if you get this kind of help, okay? So what it comes down to, folks, to me, picking a plan is like being a sculptor. You have a block of wood or a piece of stone, and as the sculptor, he or she envisions a figurine in there, right? And they start chipping away because they know what they don't want and they know what they want, but they don't know where it's at yet. So they're chipping away, and everybody's chipping here. We're all going to wind up with our own personal figurine, right? That's the way it works. So picking a plan is the same way. Let's say our block of wood would be, let's say, 40 available plans. But we already discussed plans. For example, we started with 40. John, how am I going to come up with that? It's too many. Well, we said we didn't want an HMO. Boom, boom, boom. We're down to 20. We said that we checked your doctors. 10 of them don't have all your doctors. Boom, boom. We're down to 10. 5 of them have a drug plan, and that covers all your medications. We're down to 5. Okay? 2 of them are higher tiers. We're down to 3. So you can take knowledge to take away, it's addition by subtraction, what you know you don't want, and you get what you want. And one thing that the CMS does, Medicare, is that they rate every plan every year, every plan on the STAR system, 1 through 5, 5 being the highest, the best, right? So you can look at that. If it's close, you can look at the STAR rating and decide for yourself how important that STAR rating is to you, right? Higher, low, whatever, there might be some other choice. But I'm saying there's a lot of information that you can use that we sit down with someone so that we want to eliminate, we want to get to the right plan, and we have a lot of information if we follow it correctly. Is that all right? You understand that point? So here's where we are. We know that we want to take one or the other, because otherwise that slide that we went over, it's the ugly one. We don't want to deal with that. So you're either going to go to original Medicare or to Medicare Advantage. So let's go this way first. You get your Part A and Part B, that's part of original Medicare. Your Part B, you're paying the $148, you got to pay your Part B premium. You get a Medigap supplement plan to pick up that other 20%, let's say, right? And let's say that's $200. Let's say that's $200. Just throwing a number out there. So you got $150, because we made that $150, $200, $350, and let's say a good drug plan is $50. So that's $400 on this end. Okay? It's pricey. The advantages of that type of plan is that you can go to any doctor, any hospital, no networks, no referrals. You want to go to the Mayo Clinic, you call up, make an appointment. You want to go to, Anderson down in Texas, Cleveland, you can go to different places you can travel around and use your plan. So that's important to a lot of folks. And if they got a lot of medical issues, they don't want no choices. You're paying up front, but you got the coverage, right? The other side, you're feeling healthy and you're doing okay. So you go with a medical advantage plan. Then let's say it's you still got your Part B premium, right? And let's say the plan is $50. So that's $200 versus $400. But you're getting some additional benefits there. Some dental, some hearing, some vision, over-the-counter, gym membership. So you have to decide at that moment. I'm pretty healthy, because in New York does a good thing. You can go back to a supplement plan later on in years. If you start, your situation changes, okay? There's no medical underwriting in New York. And there's only 1 or 2 states that do that. Other states, if you missed that one time, you missed that opportunity, you may or may not be able to get on a supplement plan, okay? And some, without medical underwriting, or they could charge you more. I don't know those states. I'm licensed in New York and Connecticut, but I hear some crazy stories, okay? But, so those are the options. But either one of these, one or the other, but not both. You can't have them both. But if you have one, you're in a good position to have what I find, in my personal opinion, Medicare is probably one of the best coverages that I ever had, with employers and stuff like that, I'm a veteran. I go to the VA, so I have some other options. And you just have to know. You just have to know this stuff. These were the enrollment periods we talked about. The initial enrollment period, right, when you're first eligible, the annual election period, which we're going to now, the open enrollment period, that's when you can change from one plan to the other in January to March. And the reason they did that, they had that and they took it away and they brought it back. Some people sometimes find a plan on their own. or somebody helped them and they didn't get the right plan. And the government says, oh man, what did I do? They give you a second chance to change that plan in January to March. Okay, it can only be Medicare Advantage plan. You can change it to another Medicare Advantage plan with a drug, whatever the case might be. There's some restrictions, but you're not locked in. Okay? They didn't have it, then they had it, they took it away and they brought it back. Special election periods, remember, if you move out of the service area, you leave employer coverage, they come up with the special election periods that allow you to make a change out of the annual enrollment periods, right? And then the GEP, that's when you miss your enrollment. That's what you don't want to be. Remember, you missed it. You went to May when you should have got it in your 9 month, and now I had to wait for January 1st, not to be effective until July. Okay? So you don't want to be in that general enrollment period. Don't find yourself.
What about people that get the extra help from Medicare? Are they allowed to switch at other times?
If they, yeah, we're going to talk about that in a second here.
Okay.
First, you got Medicaid for low-income individuals, right? It's all driven, that's state programs, right? Then you got TRICARE for Life, which is military, retirees, and dependents. And there's a thing called CHAMP VA, civilian health and medical program for people from the VA for dependents. And that helps you. You know, it's another government entitlement program like Medicare and the CHAMP VA, and so they work together so you can get some coverages and with your medical expenses. Okay, federal and state plans for retirees and dependents. You know, some federal agencies, they usually just want you to have Part A and B. Okay, group health plans, they could change a little bit, and they have a little more flexibility with some of their rules. But you would also always check with the HR people or your benefits people to get the particulars, so you don't get stuck with any surprises. And New York EPIC program. So the EPIC program, everybody should apply for it whether you need it or not, and you may not use it. But what it does, it has 2 schedules. It's for drug coverage. So the first schedule is and we have the application here. I'm going to give you a copy so you can read it. A fee schedule where you pay based on your income up to $75,000 if you're single, $100,000 for a couple, finally jointly. And let's say you're at $30,000 and your fee is $300. You pay your Part B deductible, you pay the fee, but then you don't pay more than $20 for any medication that you need. So that could be a lifesaver if you have some of those expensive medications. Okay, so what happens is, on the other side, you have a deductible side. And some people say $2,500 deductible. You don't pay the deductible. What they're doing is that you give it to your pharmacist and they keep track of your Part D. And every time that you pay from your deductible and your co-pays that you pay, when they add up to that deductible, then your medications will only be $20 a month for that medication, okay? So imagine if you had like an Eliquis or something like Humira, one of those, you know, you burn through that real quick and you'll be getting that EPIC. And that, because you have EPIC, let's say you weren't using it, but you had a Medicare Advantage plan and all of a sudden you wanted to switch to a supplement. Well, we know that the supplement had the Medicare drug part embedded in it. So when you leave that, you lose the drug coverage. But because you have EPIC, you get a period that you can go ahead and get a standalone drug plan. So it's nice to have in your back pocket. If you don't use it, everybody should apply for it because, again, it doesn't cost you anything. It doesn't cost you anything in the program. And you need to have that assurance if you need that. Okay. Now, if someone gets a low income subsidy from Medicaid, once you get that, you are eligible for a special enrollment period. Okay. This is the EPIC formula. It's like 2 pages. I have a copy. I'd like to give you one so you have it. Give it to someone who you may know that doesn't know about it. You know, I think they have 3 people in the state talking about it. It's like a kept secret. Nobody really knows much about it. So we try to bring it to the attention. Where you can get help, first you can call me, right? Medicare Resource Group, I gave you my card. Social Security Administration, that number, Medicare itself, and the local Office of the Aging. They have folks that can give you some information and some help as well. Okay? And that's me right there. That's my contact information. And so I'm here to help you today, going forward, Any questions? Anyone that needs help in finding out which way they should go or how Medicare could work for them? Some folks have been to seminars that maybe didn't hear about the Epic, and they said, I learned something, even though they knew a lot of this stuff, but one or two things that they might have learned to help them. And so that's the end of the presentation, folks.